Once again, for those that don't know me, I'm Dr. Shelley Coleman Glover. I am a board certified gynecologist, obstetrician who practices solely gynecology now. My office is located in Claremont, Florida, which is a suburb of Orlando. And that is located, of course, in Central Florida. And we have been doing a COVID Live update every Friday, coming to you, giving you information on how to cope with COVID, because we have been living with COVID now. We are completing a month 8. It's crazy, actually 9, and it depends on if you want to count the, I'm talking about when the United States has been in the thick of things, because it's been since March that we've really been in the thick of things here, and we are now about to go into November. So anywho, let's go over the numbers like we normally do, and then we will talk a little bit more about what's happened over the last week and talk some about Halloween as well as about breast cancer. Alrighty. And hopefully it is gorgeous where you are. I know the weather changes throughout the country. Of course, here in Florida, it is sunny and gorgeous. Actually, a little bit cooler than usual, which is nice for us. Got a little bit of a breeze, so we are having a beautiful Friday afternoon. What's going on with COVID over the last week? Well, our cases worldwide are at 45.3 million. 45.3 million people with diagnosed with COVID thus far in the world. 1.18 million people dead. And the positive, 30.4 million survivors. So that's always a blessing. We are very happy for every single person that is survives COVID. In the United States, we're at 9.02 million people with COVID. That's over 9 million people. I mean, that's bigger than a lot of states, guys. Come on. So we're talking about losing a huge chunk of people. It's not just a number. These are really people that are getting it. Excuse me. They're not. Thank God we don't have 9.202 million people dead. We have 229,000 people dead, though, and that's a lot of people. And if it's somebody that you know or a loved one, then it really hits home. And as we've said over and over again, it shouldn't take it being a loved one to get you to hopefully take this serious. COVID is not a hoax, no matter what you hear, see. It just isn't. It just isn't. And if you haven't had somebody personally in your circle that has gotten it, then you're very blessed. And count yourself blessed. But we've got a long way to go in COVID land, and so it will happen eventually, especially if our numbers continue to go the way they are. We have 7.45 million survivors, though, so that is obviously a blessing. Within the state of Florida, we're at now, if you round it up, 800,000 cases. It's 799.7 thousand cases, up from 748,000. So our numbers are going back up again, and we're at 16.7 thousand deaths. The worldwide, a lot of, especially in the European continent, they're seeing a big uptick in cases again. So we're even in countries where they thought they had a really good hold, a lot of them are having a big second wave, they're calling it. We're in the United States, we're on our third wave, we believe. Excuse me. And so they have instituted a lot of new lockdowns, and even in countries where they were doing really well, like in the Czech Republic, they were doing great. They were their numbers were at the original pandemic, they had curved them down. They had minimal cases, and now they're at the point where they've had cases over 100,000 a day, people testing positive. So they're really out of they're in a major crisis, and many of the states and many of the countries are. And so this is definitely, we are not alone in this anymore, as far as we still, unfortunately, though, are way ahead of everyone else. The other countries that are behind us, India, like I said, we are at 9.02 million cases. They're at 8 million. Brazil, 5.5. Russia, then there's a big drop off. Russia's at 1.6 million, and then now France is behind that at 1.28 million. And sometimes the deaths don't always correlate with the numbers. It has to do with the healthcare and access, once again, to higher level healthcare, like intensive care units when people are severely ill. So France's death rate actually now is higher. They've had 36,000 deaths compared to Russia has only had 28,000, and still that's 28,000 people that have lost their lives to COVID. But they have more cases, so they are doing a little bit better than France as far as their treatment at this particular time. Brazil, 159,000, whereas India, once again, so Brazil has lower numbers, but India has actually, even though India has higher numbers, they have less deaths. And then, of course, then you come back to us, and we have more deaths in the United States than anyone. We're at 229,000, so we're still over 100,000, almost 100,000 more people have died here in the United States, and people are still dying every single day. So we need to be aware of that. And I was watching one of the shows, and they said, a lot of people are saying, well, it's, we can't be saying that the United States is doing such a bad job because it's happening everywhere. And what the physician said is that it's a sad day when the United States is let me see if I can get the wording right, when the best that the United States can be is to be the worst at treating the COVID pandemic. So we really don't, this is not, having the worst numbers in COVID and the highest number of people dead is not something that we should strive to be. In the United States, bringing it closer to home, California still, Texas has the most number of cases at 939,000. They've actually surpassed California, and 18.4 thousand dead. New York still is the highest just because of all those that they lost originally, and their numbers have started to go back up again, and they're at 508,000 cases and 33.1 thousand dead. Illinois is now joined the ranks of the high cases, and they have 402,000 cases and 9.96 thousand deaths. Florida here is 799,000 cases, up from 748,000, and 16.7 thousand cases, of 16.7 thousand people that have passed. And I don't break out Florida residents versus non-residents. My thought process is that if you're here in Florida, and you're here when you died, then I'm going to count you as a Florida death. If you want to subtract that out, you can take out 200 people, but that's not in the big scheme of things making a big difference. The numbers have surpassed. We've had 500,000 new cases in the United States in the last week. That's crazy. 500,000 new people being diagnosed. And there's, you'll get the naysayers that say, oh, that's just because you're doing more testing. No, it's not. We have 14% increase in testing. That's a good thing. So yes, there's more people going out and getting tested this month. But there's 60% more positive cases. Do the math, people. It doesn't equate. It doesn't add up. So there are, unfortunately, way more people that are actually getting coronavirus. It's not just because there's more testing going on. And of course, if we have that many more people getting coronavirus, it's just a matter of time before we have way more people becoming severely ill, because we already know the data. We know that 20% of people that get COVID are going to become severely ill and require hospitalization, and that 2% of those people are going to die. Now, our numbers have been really good as far as deaths in many of the states, not all of them, but many of the states, and one of the reasons why has been because of the advances that we have made with treating COVID. However, as our numbers go up, as that 20% of people that need hospitalizations goes up, we're running out of hospital beds. And so there's becoming a huge crisis in a lot of the states. Wisconsin, in the Midwest, where they said, oh, look at us early on in the pandemic, we're good, we don't have it, we're spaced out, we don't have to worry about this as much because we don't have the big cities, and we social distance just because. That's not standing true now. And so we're seeing that the Midwest states are actually getting hit the hardest. Wisconsin has had to set up field hospitals. They're talking about converting a whole stadium into a hospital. El Paso has, Texas is really getting hit hard, and they've actually officially run out of intensive care unit beds, and they have also satellite hospitals set up. So once again, mistakes can be made. New York obviously had mistakes that were made, but we're supposed to be learning from mistakes, not starting over again. So we need to pay attention to what can help, and we need to work together. This is a pandemic that's affecting all of us, not just people over there. It's now in all of the states, and there is not one state within our United States that has seen a decrease in their COVID numbers. So just so we're all on the same page, because there's a lot of false information that flows around on the internet and social media. So just want to make sure we're clear on that. Speaking of now, within Central Florida, because that's where I'm located, Lake County, just so you guys know, which is where my office is, the numbers are at 8.6 thousand cases. That's up another 600 in a week, and 731 hospitalizations, up from 682 total, and 287 deaths, which is basically almost 99 deaths increased. So these are people. These are real people that are dying, and these are people, if you live in Lake County, that you may know. Within Orange County, 45.7 thousand cases, 1,597 hospitalized since the beginning, and 559 deaths. So obviously Orange County is a much larger county, but it just shows you where we are with that. The median in the state, the age is about 40. Lake County, our age is 43. We have an older population, and Orange County is still at a younger number at 36. But that's up from when we were having our major issues earlier in the summer, and it was at the median age was like 30 to 32. We have 90,000. We've topped and actually equaled where we've had 90,000 positive cases in a day, where people are testing positive, not just here in Florida, but throughout the United States. So to put it in another way, I heard it mentioned is that means the virus has found a host in one of us, in a human being in the United States, 90,000 times yesterday. So, because it's like I said, it just is, these numbers just kind of, people just roll them off, and if you don't put them to home, if you don't really think this is a person that is dying of a disease that they probably contracted within the last 3 weeks, and they're dying from that. And so, or this is a person that is now getting the disease that was completely healthy, and what are the long-term ramifications of that, and so even if they're not having symptoms, what's going to happen in a week, in 3 weeks, in 3 months, next year? What is this disease doing to their bodies? We don't know. So just please keep that in mind, and it's not a good goal to be trying to just say whatever happens, if I get it, I get it, because you don't know if you're going to be one of those 20% that doesn't do well. And the rate is going up in children. We've seen a 14% increase in coronavirus in kids in the last 2 weeks. Luckily, yes, the majority of our kids do markedly well with coronavirus, which is a blessing. But of course, the ones that do not is definitely a tragedy. We don't want to lose people of any age, but certainly when we lose our young children, it's very devastating, because they have so much of their life to live. There have 24 states have actually set records this week with exponential growth. 24% increase in cases, positive cases in Iowa, 20% in Kansas, 38% in South Dakota. So South Dakota is actually in a major crisis. And we're starting to see we were at full reopen, and a lot of people had gone back from their virtual meetings and had started to do some in-person meetings with mask and with social distancing. And now I'm starting to see, especially like with the hospitals and stuff, where they're starting to take their meetings back to virtual for the protection of the staff. And so just be aware of that. Before we get into Halloween and what we can do with all of that, let's just go for a couple of misconceptions, because there are quite a few out there. So there are actually 4 that I wanted to touch base on that you may or may not have heard about. So number 1, mouthwash does not prevent coronavirus. So yes, mouthwash is great. Have fun with it. Certainly, you're welcome to swish and swallow, garlic, all that fun stuff. But don't think that you're mitigating your coronavirus risk, because you're not. So please be aware of that and do not use that as something that you're relying on. Number 2, there is some information going across on social media saying that there is a study out there that shows that people that get flu vaccines are actually more likely to get coronavirus. That is not true. The study that they are referencing was actually written last year, way before coronavirus ever hit. And the author was talking about, remember, coronavirus, there are many, many, many coronaviruses. The common cold falls under coronavirus. And that's what the study was actually discussing, is that with the flu vaccine last year, that they actually were seeing a slight uptick in people getting common colds that were getting the flu vaccine. So that is what the author was discussing. He has actually come out himself and said, do not take his study and apply that to the COVID-19 crisis, because that was not what that study was about. And he is actually encouraging people to get their flu vaccine. So just so everyone's clear on that, if you hear about that, is what that is all about. Okay? Masks don't work. We go through this all the time. So, and there are plenty of people, and there are physicians out there that will also say, they don't work, blah, blah, blah. The mask is not to protect you as much as it's protect you from giving it to someone else. And they do work. Okay? When you look at, you can look at Arizona's data. So Arizona was, actually their cases were going up. And so they actually implemented mandatory masks, shut down some of their their bars, their high risk areas, did a mini shutdown, and they actually, their numbers went down significantly. So it does work to social distance. It does work to wear masks. And there's a study out there, Lancet study, and they said that if you're not wearing a mask, that's a 70%, and you have coronavirus, then that's a 70% risk of transmission. And I think that's low. With a mask, the risk goes down to 3%. That's 14% decrease in numbers. And that may not, once again, statistics all sound kind of funny or whatever, but trust me, if somebody told you that, if you are gonna, that you can get, if your risk for herpes was 17% without wearing a condom and 3% with wearing a condom, I guess I can guarantee you would put that condom on. And so, we have to I try to put it into things that people can kind of make some understanding to and understand what we're talking about. So this is a serious thing. The mask does help. It does work. Yes, we've gone through it a billion times. I'm not going to hash it out.
1 in 3 adults has pre-diabetes. That
Hold
means
on
it
one
could
second.
be you.
I told you guys that's going to be my little commercial.
You're Barbara's
Hold
barber.
on, shut
Nice.
up. They want to sell us stuff, but anyway. So so just be aware that I personally highly recommend that you wear your mask. And there's another thing that, if you may remember, there were 2 hairstylists that actually had COVID-19, and we are not recommending this by any way, shape, or form, but they continued to work with coronavirus. I don't know whether they knew they had it or not, but they were wearing masks, and the salon they worked at had very good what do you want to call it, protocols in place, including mandatory mask wearing. And they went back and they went over all of the people that they were exposed to, all the clients whose hair they did, and not one of their clients got COVID-19, which is amazing, because remember, coronavirus is easily killed, but it's highly contagious. So that just shows you that with whatever practices they were doing, including wearing a mask, that they were able to mitigate that risk to all of their clients, even having had COVID. And that's the thing. You don't know if you have it. That's the problem. The majority of people that get it are actually asymptomatic. So you can't just assume, you can't look at somebody, nobody has that sign on their head that says I have COVID. So please, please, please wear your mask. The last misconception we'll talk about is that, so of course we've got people that are petrified of the vaccines, but then we got a whole nother slew of people that are basically just saying, we can't get control over this. We'll just wait for the vaccine. Once we get the vaccine, everything's going to go back to normal. First of all, only half of Americans are saying that they're going to even get the vaccine because of all the fluff and all the concern about the vaccine being pushed too fast, et cetera, et cetera. So if only half the country gets it, then we're not going to be getting anywhere but so fast anyway. Secondly, there aren't going to be a billion vaccines available right away. So even if you want the vaccine, you're not going to be able to necessarily get it until springtime if you're lucky. And so it's not going to be one of these things where there are now 11 studies in. Let me see if I'm right. Am I right? Is it 11? Yes, there are 11 vaccines in phase 3 trials. So we will have a vaccine hopefully by the end of the year, if not early next year. That's what they're predicting. But to even produce that in mass numbers, we are not talking about we're going to have a significant portion of the United States vaccinated before, like I said, probably even summer, definitely spring, and even after the vaccines are in place, we're still going to have to do social distancing. We're still going to have to use masks until we have the majority of people having been vaccinated. So they're talking about us going back to normal at the end of 2021, so looking like around now next year, or even into 2022. So unfortunately, that's why we talk about coping with COVID, because this is not something that is going to go away, even if we get a vaccine. So I just want to make sure that we're clear on that, so that you're not thinking short term, because if you're thinking short term and then it doesn't happen, then of course that just elevates our frustration level, which was already elevated. Everybody's frustrated. Everybody's sick of COVID. I'm sick of COVID. I talk about it every week. I'm sick of it, but I talk about it because it's necessity, not because I enjoy talking about it. I want to make sure that you guys get good information, because there is so much crap out there. So that's why I come on every week, so that I can give you information, and so that you don't have to worry all week about it and listen to all the crap, and that you can come on and get some base data. So hopefully this is working for everybody. I hope it's helpful. So that takes care of those 4 myths, and hopefully that helps you. I know that people kind of believe what they want to believe. So if you still want to believe, whatever person you read on Facebook over reading, paying attention to studies and reputable information, then that's on you. All right, so let's talk about some fun stuff. Oh, so one positive study that just came out is that Mount Sinai just came out with a study, and they're showing that it appears that at least in some people that the immunity after getting COVID is may last as long as 5 months. So that's exciting, because also we extrapolate that and hope that the immunity from the virus would last that long too. We know that even once you get your vaccination, that it's probably this virus morphs. So even if you get protected now, that it doesn't mean you're going to be protected. In 6 months or a year. So, but if we can get 5 months versus 2 months, and every month that we can get immunity lasting is a blessing for all those around you, and for you as well. There have been cases of reinfection, just so we are clear. There have been cases of reinfection, well-documented cases in the United States. The numbers are low, but it is possible. So if you have had coronavirus and you think that you're immune, you should, and it's been over 5 months, you should go back and do an antibody test and make sure you're still immune. And so that you're practicing safely, and that you're not assuming that you can't get it and you actually can. So let's talk about Halloween. We brushed on this a couple of segments ago, but Halloween is tomorrow. And so there are some things that we can do. There are things that are being discouraged. So one of the things that is being discouraged is the routine door-to-door trick-or-treating. And I know that sounds mean and negative, but the reason why is, think about it. First of all, what usually happens, and I can tell you because Halloween is actually the biggest holiday in our subdivision. It's really huge. It would have been outrageously huge for us this week, because it's a weekend and the adults actually get into it probably more than the kids here. But when you have door to door, then the kids tend to congregate together, and they're not there that long. But then, the person that's handing out the candy, their hands are touching the candy. Then you got multiple hands going in the bucket touching the candy. We don't know who's got what, so that's why they're recommending not to have that. But there's lots of fun, inventive things. The internet is your friend. They're talking about like maybe taking like a PVC pipe, putting a little curve to the end, and actually shooting the camera, decorating it and shooting the candy out at the kids. Not shooting like bad, like not super fast where it's like a deadly weapon or something like that, but having it fly through the chute so the kids can get it on the other end, so it becomes like a game. And it's definitely, the PVC pipes are long enough that you're 6 feet away from the kids, so that's a great idea. That's more work than I can actually handle right now, but what we're actually looking for is like a zip line. We're going to take it from our balcony and take it down to one of the trees near the street and see if we can figure out how to hook the candy into a bag and have it fly down. I think that'd be a lot of fun. So if we don't pull it off, at least we'll have fun trying. If you don't feel like getting that inventive, the other thing that is recommended is to take a table, set up your lawn chair out on your lawn. And I'm a big fan, just so you know, what works really good to keep the mosquitoes away is the Raid Yard Guard fogger. That stuff works. You got to spray before the mosquitoes comes out, so you got to spray right before dusk. It works for 6 freaking hours. It works beautifully. And so if you spray wherever you're going to be sitting, bring out some lawn chairs, put out a table, and put the candy out, that is considered much safer. They do recommend that you put the candy in like little baggies so that the child can just grab one thing versus trying to grab multiple things off of the table, or if you want to give them 3 pieces of candy, put them in little piles separated away from each other so that the kids aren't touching the same piles. And then after, obviously, that area is the child has touched it, then wiping that area down. So that the parents of these kids are not concerned. It would be great if you had on some gloves, if you have access to those, or at least have some hand sanitizer there, and that you're actually using it, and that you wipe down the surfaces, like I said, before you put the fresh candy out, and have some hand sanitizer out there for both yourself and for the people that are going by and trick-or-treating. One of the things we do want to be careful with the mask is that that the kids do wear masks unless they're really little, but what you don't want is double mask where the kids could actually have trouble breathing. So if their costume has a mask, like I'm thinking kind of like a Spider-Man costume or something like that, have to be careful about putting another mask on top of that. So you're going to have to use your discretion on that. Obviously, we don't want big parties, whether they're indoor or outdoor, where kids are having to yell over the music, because once again, every time we're yelling or singing and stuff is flying out of our mouths. And if you don't believe it, take a mirror, put it in front of your mouth and sing, and you will see how much saliva hits that mirror, and or just talking, and you will actually stand there and talk to yourself or sing for like a couple of minutes, and you would be surprised what you see on your mirror. So you don't believe that you can transmit, that's an easy way to see that you do, and we transmit all the time. So these are things that are helpful. The other things that you can do that are completely safe is obviously decorate your house, make it fun. Even if kids just go by and see the decorations, it just makes people feel warm and fuzzy. You can do hay rides, but they're recommending that the hay rides are spaced out. You're not sitting, once again, huddled on a hay ride, especially for an extended period of time, next to somebody that you don't know, and or wear a mask if you are going to be next to people that you don't know. But definitely, if it's just your family, by all means, that would be a great idea. Or if you can space the kids out, great idea for a nice fun event. And plus, with the hayride, you're moving, so you're moving air at the same time, so that's another thing. Obviously, we don't want to be bobbing for apples or anything like that. Pumpkin carving, great, as long as it's not dangerous for the kids to do, and you could certainly set them up six feet apart on tables, and they could do that. Outdoor, even better. So there's still things that can be done. Halloween does not have to be completely scrapped, and I do encourage you to enjoy your Halloween. And I encourage you to decorate if you haven't already done it. I know it's late, but if you haven't decorated and you don't want to either decorate for Halloween or just decorate for the fall. We did that to our office 2 weeks or 3 weeks ago now, I think, and it just changes the whole atmosphere into a much more just relaxed, less stressed atmosphere. It just doesn't feel like, that COVID bull. And, in a medical, office, of course, we're wiping everything down. We're just being really super careful. And so, there's not enough chairs in the waiting room. It's just this little dark. There's no magazines because we don't want people touching, and so it's just kind of nice to have the decorations, and we just have everybody that comes in the office is just like, wow, it's so nice to just remember that it is Halloween and that there is a world outside of COVID, because you can get mired in there, and we can't. We have to learn how to cope with COVID and move forward and live as normal of a life as we can while being safe. So, having said that, that brings me up to now just closing out on breast cancer. And so I'm going to try to show this video for you guys. And like I said, I am not that tech savvy, so I'm going to have to flip screens, try to pull it up. It's actually on WESH News 8 out of Las Vegas. And so we may have to watch a little bit of a commercial, but this is Dr. Maria Keller. She's actually a very good friend of mine, and she is actually actively treating her breast cancer, and was interviewed by this news commentator called, I think her name is Monica, about how she discovered her breast cancer and what happened with all of that. So I thought that it would be nice to share that with you, and then we'll talk a little bit more about breast cancer, and then we will get on off of this COVID update. So here we go. Stay with me for just a second. Let me see if I can do this. And like I said, we might have to watch a commercial on diabetes for just a minute, unfortunately. So bear with me. All right, now I have to just go out here, and then I have to hit play.
Work. Thanks.
With early diagnosis, prediabetes can be reversed. Take the risk test at doihaveprediabetes.org.
Welcome back, everybody. 6:43 right now. I'm Monica Jackson. Thank you all for joining me. As you start your work week, I'll be here every Monday morning for Mondays with Monica, and I'll be talking about everything like parenting, getting you through the pandemic. But this morning, I have a cautionary tale for you. So if you have a second, especially ladies, in particular mothers, please stop what you're doing and pay attention. October is Breast Cancer Awareness Month, and as we come to an end, I want you to listen to a story of a local doctor. She is a board-certified doctor, been in practice for 20 years, has 2 adult daughters, but it wasn't until a freak accident just at the end of last year where she learned that her health is just as important as that of her patients. Her name is Dr. Maria Keller. Dr. Keller, how you doing?
Doing great this morning. Thank you for having me, Monica.
Thank you for coming. Okay, let's get right into your story. Take me to that moment last year where you had a freak accident and then, excuse my French, all hell broke loose.
Absolutely. So I was doing shopping, went to a store, bought a piece of furniture. Actually, it's behind me, and it had a long leg. And I went to reach it as the basket was rolling towards me, and the leg of this ottoman stuck me very hard in my right breast up high, almost like a javelin. It took my breath away, actually.
Mm-hmm. What happened after that? Because you had some bruising and then you took a closer look.
So about 2 days later, I was looking in the mirror and I saw a lump in the upper part of my breast. I was examined it and I felt the lump. I'd never felt a lump there. I'm an OBGYN, of course I know how to do breast exams, but I had not felt a lump in that area of my breast ever. Mm-hmm. And within 3 days I got a mammogram showing that it was suspicious for breast cancer.
And I can't imagine that, Dr. Keller, because I know you have 2 adult daughters. That would freak me out. And like a lot of women, I was late with my mammogram, but I know better. You know better than most. It was cancer. What did you do from there? Because in that very moment, I know your life changes. It flashes.
So when I got the mammogram, I'd asked, how long had it been since my previous mammogram? And I was blown away. 4 years. And how does that happen? I'd maybe gone at most 2 years, but never that long. But I got busy with life. I moved my practice from one location to another. I had issues that happened in my business. I did a home remodel, and time just got away from me. Mm-hmm. And so I kicked into action. Initially, I kicked into denial because I didn't want to believe the diagnosis. I kept thinking it was like a hematoma, a bruise, a swelling. Yeah. And so about a month later, I was with my best friend, and she said, Maria, repeat your ultrasound. She's a breast cancer surgeon, and I did. And she said, if they recommend a biopsy, get the biopsy. I did, and the biopsy showed not only cancer in the mass, but also cancer in my lymph nodes.
Oh,
so
my gosh.
It was advanced cancer. Actually, I'm diagnosed stage 3C, which is one stage, the next stage before, metastatic stage 4.
Dr. Keller, I've already admonished you for this because I know you know better, but I also understand as a mother, as a professional, time does get away from you. And now that we're in the midst of COVID, everybody is afraid. Before we close out, I want you to give some advice to our viewers, our mothers in particular, but women overall, because we cannot be so afraid that we miss these appointments. My mother is a breast cancer survivor, and so my sisters and I always have to get our mammograms, but I was afraid. I was late coming to you, and when I saw you, you were 30 pounds lighter, and it scared me. So please give a final piece of advice to our viewers.
Well, the thing that I would say is the 30 pounds lighter, 20 pounds of it was from exercising. 10 pounds came from the stress once I got my diagnosis. So, but what I would say to women is that if you're late, if you're delayed, please don't hesitate. I didn't have really any symptoms. I would have thought I would have felt sick. I was a little tired at the end of the day, a little cold, but nothing that would be a significant symptom that I would have expected, that my body would have showed me a little bit more. And so right now, there was a point in time when we had to shut everything down for screening for mammograms for women because of COVID. But now we know how to safely take care of patients. We're doing the social distancing. And I don't want women to delay and hold off on their mammograms. It's so important for us to get in there and get the mammogram so we can get the earlier diagnosis. That is the goal of mammography, is to pick up the breast cancer sooner.
Absolutely. Doc, I'm out of time, but I want to let our viewers know, first of all, thank you so much for sharing such a personal story. But ladies, if you would like to connect with Dr. Keller, please give her a call, 702-671-0006, or you can log on to her website, liveagelessly.com. You can also find this information on our website. You can check it out, 8newsnow.com. Again, doctor, thank you so much. Ladies, I hope that...
All right, guys, I hope that you were able to see that. Hold on. I'm going to close it out so we don't go back to it again. So hopefully you guys were able to hear and see that. Like I said, I know Dr. Keller, and I wanted to get her on, but this is Breast Cancer Awareness Month, so I wanted to get her on this month and wasn't able to. So I thought I would show the video because I thought it was really important to hear that even physicians make mistakes, and we can get lax on our healthcare just like everybody else. And I always say physicians actually can make the worst patients. And so do as we say and not as we do when it comes to that. You should be getting your mammogram every single year after the age of 40. I know we talked about this before. You can certainly go back to my prior segments over the last 2 weeks to get more information about breast cancer and the recommendations for mammography. But the key thing is early detection, early treatment, early cure. And don't let COVID keep you away. I understand that the numbers are going up, but the hospitals are very thorough. So you can't, I can tell you, when you walk into my primary hospital, which is South Lake Hospital, they have guards at the door. You cannot pass there without A, having a purpose, and B, having a mask. They provide you a mask. If you don't have one, you have to wash your hands, or I guess they have the hand sanitizer actually there, and they still and they're doing temperatures. So it's and then once you get there, everything, of course, everything was wiped down beforehand, even because it was a hospital anyway. But now it's even more just everything, from check-in to where you're sitting to when you get into the mammography unit, everything is just completely wiped down. So yes, it's safe. Go get your mammogram. It is definitely worth it. You do not want to be like Dr. Keller, where you're finding a mass and wondering how long has it been there. Like, she hadn't had 4 years is really long, so, she gets a big F- on that one. But it doesn't, we don't know. So we don't know even if, so maybe if she'd gotten it a year before, it would have been negative. We don't know. Some cancers grow faster than others. But the key thing is that if you examine it every single year, we're going to hopefully catch it way, much earlier stage, so that more things are not required. And we're also going to, be a survivor. If it's caught in stage 1, the survival rate at 5 years is 99%. I mean, that's amazing. So early detection, early treatment, early cure. You get a mammogram, we smush your boobs, you get your boobs smushed every year after you're over 40, and I do recommend, like I said, one between 35 and 36 and one between 37 and 38. And then you get into your doctor and you get a breast examination every single year. Now, I just want to talk to you a little bit more about breast cancer as far as I get, as a gynecologist, I see patients, for anyone that doesn't know, we diagnose a lot of breast cancers, but the breast is actually in the realm of general surgery. And so the breast surgeons are actual general surgeons. They are not obstetrician gynecologists. And that's just how things got divvied up when things were happening. I guess it was, we call them turf wars. And so way back when, that's what happened. So women, gynecologists kind of do surgery from in the pelvic area. That's our realm. And the general surgeons and or breast surgeons are actually do the breast as well as obviously the abdomen, etc. And then we can break things down to other things as well. So anyway, having said that, I see many women after they go through cancer, and I see a lot of patients, and they feel like after they've been treated for breast cancer that means that if they either go through menopause because of the breast cancer, or if they go through menopause later, just because they're a breast cancer patient, that they have to tough it out and they have to be miserable because they can't get hormones or any kind of treatment for their menopausal symptoms. So that is not true. So I want to make sure that everybody is clear on that. First of all, there are different types of breast cancer. You don't want to get breast cancer. That's first, second, third, fourth, and fifth, right? But if you get breast cancer, then you want to be a breast cancer survivor. And the way that you become one is, once again, by early detection. But the second thing is that having a well-differentiated cancer is way more favorable. And so well-differentiated cancers mean that the cancer is mimicking the organ it's in. I tell women, your breasts are sensitive to estrogen and progesterone. So when someone tells you that you're diagnosed with breast cancer and that the cancer is estrogen receptor positive or progesterone receptor positive, that's actually a good thing. That's not a negative, it's a positive, okay? And then the HER2, being HER2 positive used to be considered a negative, but now they've got medicine specifically geared to treat HER2 cancers, and so that doesn't have to be a negative anymore. It just, the HER2 positive versus negative helps them to figure out how to treat you, and that's the goal. The goal is to be a survivor and to get the right medications to get you well. The other thing, that the estrogen receptor being positive, it's a positive because they can use that for treatments that are geared towards that estrogen receptor. And so they trick the estrogen receptor on the breast cancer to thinking it's getting estrogen, and instead it's giving them a medication that is going to negatively impact the cancer. And so that is what that whole receptor status, because we get that and people are really confused about all the time. Do I think that estrogen causes breast cancer? No, I don't, okay? I'm a gynecologist. I deal with hormones all day long. If you think about it, when you're pregnant, your estrogen levels are through the roof, as are your progesterone levels. And we don't see it, thank God. It's actually rare to get breast cancer during pregnancy. So if that was the culprit, if hormones were so bad, then we would have pregnant women dropping dead left and right. And we'd have all these women who've been on birth control pills for years and years and years with breast cancer. We don't see that. We actually see breast cancer after age. The most common age is actually after menopause, when the hormone levels are going down, when women aren't on a birth control pill, when women aren't taking high dose hormones, when their hormone levels are dropping. So it seems to be the imbalance in the hormones that is more of a problem than it is actually the hormones themselves. So now I certainly follow levels. I don't just throw people willy-nilly on hormones. I don't put people on a lot of estrogen. I actually am much more of a testosterone and progesterone, natural progesterone user, and we use bioidentical hormones, which are identical to what your body naturally produces. Do I have breast cancer survivors that are on hormones? Yes, I do, on a case-by-case basis, and it depends on how far out they are, what kind of breast cancer they had, etc. And I work with their breast cancer surgeons and or oncologists regarding that, and that's, like I said, on a very individualized basis. But having said that, there are a lot of non-hormonal treatments available for women. So don't think that just because your oncologist has told you not to be on hormones, or you're petrified of being on hormones, that you can't do things. I tell patients, we take you from soup to nuts, and do a lot with natural supplements, he said with bioidentical hormones, testosterone actually has been used in the distant past to treat breast cancer and actually decreases fibrocystic changes on the breast, but that is still a hormone. But then there are other things that we can use. Like one of the things that a lot of women complain about is vaginal dryness or pain with intercourse. And there are some non-hormonal treatments that can be utilized. There's something radio frequency to the vagina, so that sounds kind of crazy, but we actually heat up the tissue in the vaginal vault, and that stimulates collagen and rebuilding in the vaginal vault, which helps with discomfort and dryness. There's radio frequency, there's a laser, you may have heard of it, called the Mona Lisa, there's Thermiva, there's, oh god, I'm blanking on the other name. And so all of those, you guys know that I'm a vampire procedure physician, and so obviously the O-shot is really good for the vaginal area. Women can actually, with the blessing of their cancer doctors, usually be on vaginal estrogen, because when we're using vaginal estrogen, it's not the same as being on what we call systemic estrogen, where the estrogen's throughout the body. The amount that's used in the vagina is the same as taking 4 hormone pills throughout a whole year, and so it's like 1 hormone pill every 3 months. So it's nothing. It's absolutely nothing. And once again, case by case basis, and it depends on where you are in your breast cancer journey. But don't think that, especially when you're dealing with that kind of stuff, that you are just out there and that you can't do anything. As far as there are things that we can do that are non-invasive to help you sleep at night, and it doesn't mean that you have to be, I'm not a big fan of sleeping agents like Ambien. I know there are millions and millions and millions of people that take it, but there are more natural things that can be used to help you sleep, to help you be cool. You can use essential oils. There's so many different things that are out there. Now, what I do warn you, though, because I do get some people that come in and they think they're doing a good job with themselves because they've gotten something that they saw on the internet, or they've gotten something that they found over the counter, and they think, okay, well, this can't hurt me because it's over the counter. You don't know that. So if you are picking up a product, first of all, there's no regulation on over-the-counter products, and so when they've done studies, they'll pull things down. They could pull 10 products that say that the big thing is progesterone cream over the counter. Well, some of those creams, they work great. Guess what? They're laced with estrogen. And so people think that they're getting away from estrogen, and they're actually putting themselves right into it. Or wild yam cream, you may hear it called, or all sorts of supplements that are out there. And so the ones that work really good, you got to question that, because sometimes it means that they've actually got something in there that's not being written down as being in there. So do discuss it with your physician if you're trying to start something over the counter. Herbs are wonderful. Herbs are great, but if you don't know what you're doing, you can actually hurt yourself. So once again, if you're really going to get into herbs, you need to educate yourself. You can't just go to the health food store and you see it sitting on the shelf before you think that it's safe for you and you can take it and not worry about it, because some of those things could actually increase your risk for recurrence of breast cancer or some other negative effect that we don't want to have. So hopefully that's helpful, and I just wanted to kind of close out with some positives for the breast cancer, as well as the positives for Halloween. And as always, if you haven't, I got my mammogram this week. Was it this week? Yes, I got my mammogram this week, and I got out and voted this week, so I feel pretty like I got a couple of things accomplished. I try to get my mammogram in Breast Cancer Awareness Month so I can remember, because like Dr. Keller said, time goes by quickly, and so you may look up and think, okay, I just had my mammogram, and actually it's been a year or 2 years. But if you pick a month, so if it's not October, that's fine. It could be every November, so you say every Thanksgiving I should be getting my mammogram, or every Christmas, or every your birthday month. But you want to have some kind of a thing where you can remember when you had your mammogram last, because like I said, especially with COVID, when we think that, it seems like it's been years and it's only been months, that time does get away from you. So early detection, early treatment, early cure. Everyone have a wonderful weekend. I wish you a very, very happy and safe Halloween. And I will see you next week, Friday at 4 p.m. Same place, same channel. Please, if you haven't already, subscribe, like, do whatever it is you need to do. I know it's on, subscribe on YouTube, follow on Facebook, and I'll see you next week.